Ancient healers never had diabetes. Not because the disease did not exist. There is evidence of what we now call diabetes in ancient Egyptian medical papyri dating back 3,500 years. Ancient Indian Ayurvedic physicians described it in extraordinary detail. They called it madhumeha, honey urine, because they observed that the urine of affected patients attracted ants and had a sweet taste. They knew it existed. They simply did not get it the way we do. In the modern world, type 2 diabetes affects over 500 million people. Ancient populations, eating the foods their traditions had refined over thousands of years, showed almost none of it. The shift from ancient eating patterns to modern ones has produced an epidemic of blood sugar dysregulation that ancient healers would have found extraordinary. Because to them, keeping the blood sweet was not a medical achievement. It was simply the result of eating correctly. Today, I am sharing 11 specific foods and practices that ancient healers used to maintain what they called the sweet balance. Blood sugar stability that lasted across entire lifetimes without medication, monitoring, or medical intervention. Modern nutritional science has confirmed every single one of them. Food 1. Bitter melon. This is the single most studied natural blood sugar regulator known, and it has been prescribed for blood sugar control in Ayurvedic medicine, traditional Chinese medicine, and traditional African medicine for over 3,000 years. Bitter melon contains 3 specific compounds that act directly on blood sugar. Charantine, which has been shown to lower blood glucose more effectively than some pharmaceutical agents in clinical trials. Polypeptide P, a plant insulin analog that mimics the action of human insulin in activating glucose uptake by cells. And vicine, a compound that stimulates insulin secretion from the pancreatic beta cells. Ancient Ayurvedic healers prescribed bitter melon juice, the fresh pressed juice of the unripe fruit, every morning before food for patients showing signs of madhumeha. The prescription was precise. 1 small cup, drunk on an empty stomach before any other food. Modern research confirms that the blood glucose lowering effect of bitter melon is significantly stronger when consumed on an empty stomach. 1 cup of fresh bitter melon juice before breakfast 3 to 4 times per week. That was the ancient prescription. It remains one of the most evidence-backed natural blood sugar interventions available. Food 2. Fenugreek. Fenugreek seeds appear in ancient Egyptian medical texts as a treatment for sweetness of the urine. Ancient Ayurvedic physicians considered them one of the primary foods for blood sugar regulation. Ancient Arab physicians used them extensively. Ibn Sina dedicated specific sections of his medical canon to fenugreek's effect on what he described as the sugar disease. The mechanism involves soluble fiber, specifically galactomannan, a compound that forms a viscous gel in the gut that slows the absorption of carbohydrates into the bloodstream. When carbohydrates are absorbed slowly, blood glucose rises gradually, rather than spiking sharply. The pancreas can respond proportionally, rather than being overwhelmed. This single mechanism, slowing carbohydrate absorption, is the foundational goal of many modern diabetes medications. Fenugreek also contains an unusual amino acid called 4-hydroxyisoleucine that directly stimulates insulin secretion from the pancreas in a glucose-dependent manner, meaning it only stimulates insulin when blood glucose is actually elevated, not continuously. 1 teaspoon of fenugreek seeds, soaked overnight in water, then eaten with the soaking water each morning before food. Ancient healers prescribed this simple practice consistently. The soaking activates the galactomannan and makes it immediately available to work in the gut. Food 3. Cinnamon. This is the most widely known natural blood sugar regulator in the modern world, but it is also one of the most misused. Ancient healers were very specific about which cinnamon, true Ceylon cinnamon, also called true cinnamon, Cinnamomum verum, was the cinnamon used in ancient medicine. It contains the active compounds cinnamaldehyde and procyanidins that increase cellular sensitivity to insulin, the insulin receptor sensitivity mechanism that is the core dysfunction in type 2 diabetes. Cassia cinnamon, the common cheap cinnamon found in most supermarkets, contains high levels of coumarin that can damage the liver in the amounts needed for blood sugar effect. Ancient healers used Ceylon cinnamon specifically. Half a teaspoon of true Ceylon cinnamon added to warm water or food each morning. Ancient Egyptian physicians used it as part of medicinal preparations for sweet urine. Ancient Chinese physicians prescribed cinnamon bark tea for what they called wasting and thirsting disease, their description of diabetes. Use Ceylon cinnamon, not cassia. The distinction matters. Half a teaspoon daily in warm water or food. The effect on insulin sensitivity is cumulative, most measurable after 4 to 8 weeks of consistent daily use. Food 4. Apple cider vinegar before meals. We have spoken about apple cider vinegar for gut health. Its effect on blood sugar is equally significant, and equally ancient. The acetic acid in vinegar inhibits the enzymes that break down complex carbohydrates in the gut, specifically amylase and sucrase. When these enzymes are partially inhibited, carbohydrates are digested more slowly, producing a flatter, more gradual glucose response after meals. Studies have shown that 2 teaspoons of apple cider vinegar taken before a high-carbohydrate meal can reduce the post-meal glucose spike by up to 34%. Ancient healers across Egypt, Greece, and the Arab world all prescribed sour fermented vinegar before meals for patients with digestive weakness and what they described as excessive sweetness in the body. They were observing the blood sugar stabilizing effect empirically, watching their patients' symptoms of thirst, frequent urination, and fatigue respond to consistent pre-meal vinegar use. 2 teaspoons of raw apple cider vinegar in a small glass of warm water, drunk 15 minutes before the largest meal of the day. This practice alone, sustained for 30 days, produces measurable improvement in post-meal glucose response. Food 5. Berberine-containing plants. Berberine is a compound found in several plants that ancient healers used extensively. Barberry, golden seal, Oregon grape, and tree turmeric. Ancient Chinese medicine used berberine-containing plants specifically for what they called the 3 excesses disease: excessive thirst, excessive urination, and excessive hunger, the classic symptom triad of diabetes. Berberine activates AMPK, adenosine monophosphate activated protein kinase, a cellular enzyme that regulates glucose and fat metabolism. In multiple clinical trials, berberine has been shown to lower fasting blood glucose, post-meal blood glucose, and HbA1c, the 3-month average blood sugar marker, to a degree comparable with metformin, the most commonly prescribed type 2 diabetes medication in the world. Ancient Chinese physicians prescribed barberry root decoction, a tea made from the root of the berberine-containing plant, for patients with the 3 excesses disease. The prescription was specific and consistent across centuries of recorded practice. Modern pharmacology has confirmed that they were using one of the most effective natural AMPK activators in the plant kingdom. Berberine supplements derived from barberry or tree turmeric are now widely available. 500 milligrams before meals, 3 times daily, is the dose used in clinical trials. Consult a healthcare provider before using if you are taking any medication. Berberine is genuinely pharmacologically active, and interactions are possible. Food 6. Dark leafy greens, specifically bitter greens. Ancient Ayurvedic healers prescribed bitter greens, specifically bitter herbs and leaves, as the primary dietary medicine for blood sugar control. They understood intuitively what modern research has confirmed biochemically. Dark leafy greens are exceptionally high in magnesium.
Bitter greens also contain quercetin and other flavonoids that inhibit the alpha-glucosidase enzyme, the same enzyme that several diabetes medications target. This enzyme breaks down complex carbohydrates in the gut. Inhibiting it slows glucose absorption and flattens the post-meal glucose curve. One large handful of dark bitter greens, spinach, kale, bitter gourd leaf, fenugreek leaf, or any dark bitter green, eaten daily with the main meal. Ancient healers prescribed this without exception for any patient showing signs of blood sugar dysregulation. Food 7. Whole grains only, specifically slowly digested ancient grains. Ancient healers never consumed refined grain products. Every grain they ate was whole, unprocessed, and typically fermented or slow cooked, methods that further reduce the glycemic impact. The specific grains that ancient healing traditions universally prescribed for blood sugar control were barley, millet, and old varieties of rice, specifically partially milled or fermented rice. These grains have glycemic indices dramatically lower than modern refined grain products. Barley in particular contains beta-glucan, a soluble fiber that creates a gel in the gut, slows glucose absorption, and feeds the beneficial gut bacteria that produce short-chain fatty acids important for insulin sensitivity. Ancient Ayurvedic physicians specifically prescribed old barley as the primary grain for madhumeha patients. They cooked it long and slow with warming spices, cumin, coriander, and fennel, which further slowed its digestion. The result was a grain meal that produced almost no blood sugar spike, something that no refined grain product can achieve regardless of portion size. Food 8. Turmeric with black pepper. We have spoken about turmeric for inflammation and gut health. Its effect on blood sugar is equally significant. Curcumin, the active compound in turmeric, improves insulin sensitivity through multiple mechanisms simultaneously. It reduces inflammation in the pancreatic beta cells, the cells responsible for producing insulin, protecting them from the inflammatory damage that progressively destroys their function in type 2 diabetes. It also improves the function of adiponectin, the hormone produced by fat cells that regulates glucose and fat metabolism. And it directly inhibits the enzymes that break down carbohydrates in the gut. Ancient Ayurvedic healers added turmeric to almost every meal prescribed for patients with blood sugar complaints. The prescription was not turmeric as a supplement. It was turmeric as a daily food, consumed with fat and black pepper at every meal. Half a teaspoon of turmeric with a pinch of black pepper added to one meal every day. Always with fat, olive oil, ghee, or coconut oil. The 2000% bioavailability increase from black pepper applies equally to turmeric's blood sugar benefits as to its anti-inflammatory ones. Food 9. Intermittent fasting, the ancient morning practice. Every ancient healing tradition practiced some form of intermittent fasting. Periods of eating followed by extended periods without food. This was not a trend. It was the natural eating pattern of populations without access to constant food supply. The blood sugar benefits of intermittent fasting are now among the most well-documented findings in metabolic research. Extended periods without food allow insulin levels to fall completely, a reset that modern constant snacking prevents entirely. When insulin remains chronically elevated, which happens when people eat every 2 to 3 hours throughout the day, cells progressively stop responding to it. This is the definition of insulin resistance, the foundation of type 2 diabetes. Ancient healers prescribed a natural eating window, typically from the 2nd or 3rd hour after sunrise until the 2nd hour after sunset. Outside this window, they prescribed only water, warm herbal teas, or small amounts of specific remedies. This created a natural 12 to 16-hour fasting window every night. The simplest version requires no calorie counting or complex protocols. Stop eating 2 hours before sleep. Do not eat until 1 hour after waking. Drink water and herbal tea freely in between. This creates a natural 14-hour fasting window that begins to restore insulin sensitivity within weeks. Food 10. Amla, Indian gooseberry. This small sour fruit is arguably the most important blood sugar medicine in the Ayurvedic pharmacopoeia, and one of the least known outside of India. Amla contains the highest concentration of vitamin C of any food on earth, 20 times higher than an orange. This matters for blood sugar because vitamin C is essential for the health of the blood vessel walls. In diabetes, chronically elevated blood glucose damages the lining of blood vessels throughout the body, causing the cardiovascular complications, kidney damage, and nerve damage that make diabetes one of the leading causes of blindness, amputation, and kidney failure worldwide. Amla's chromium content also directly enhances the activity of insulin receptors, the cell surface proteins that allow insulin to deliver glucose into cells. In clinical trials, Amla has been shown to lower fasting blood glucose, post-meal blood glucose, and cholesterol in type 2 diabetic patients. Ancient Ayurvedic healers prescribed Amla as the primary fruit for madhumeha patients, either fresh, dried, or as a juice. 1 teaspoon of Amla powder in warm water each morning, or fresh Amla if available. This practice, sustained for 30 days, produces measurable improvements in fasting blood glucose in multiple clinical studies.